Thank you so much for inviting me here today. I'm here today with two of my esteemed colleagues, and I'm very excited to present together on a topic that is very important and I think affects all of us as well as our peers and the students and other trainees that we work with. So the session that we're about to start is called Nuestra Salud, taking care of ourselves while we're taking care of other people. And for those of you who don't know me, my name is Dr. Peter Uresta. I'm an assistant professor in the Department of Psychiatry and Behavioral Sciences at the University of California in San Francisco. And I'm here today with my two colleagues who are also psychiatrists, and I will introduce them in a few minutes. The objectives for this session really are to explain the unique stressors that come from being a Latinx faculty member or a senior academic leader. Other objectives will include to identify some resilience building strategies to help all of us succeed, and then also to discuss other mental health, emotional support strategies. And would love to have some of you as well share your own things that have been helpful as well. So we're here to learn from each other. So I wanted to first start with some background, to kind of put things into context. And I think for many of us, we're not surprised. I think there's been a growing body of research showing that being in healthcare, going through medical school, residency, as well as being a faculty member can really have an impact on our own mental health. Studies have shown that as students start medical school, actually, they have lower rates of burnout compared to their non-medical school peers. However, as people progress through med school, actually, they start developing burnout at higher rates than their counterparts. In addition, there are studies showing that as students progress in their training, they actually are at risk for having burnout. And these are three dimensions of burnout: so emotional exhaustion, depersonalization, as well as a poor sense or a low sense of personal achievement. In the area of depression, it's a very similar trend that we see. So as people, medical students start medical school, they have lower rates of depression. And as they progress, actually the rates start to increase. And of course, there were, as many of us are not surprised, there have been cases around the country where medical students have committed suicide. And it's been reported about 11% of med students commit suicide. Now, even though we're talking about these conditions, other things too can exist, like imposter syndrome. And I think many of us are really familiar with this. I think it's mentioned in didactics. Imposter syndrome is really the ability or the inability to internalize our sense of achievement. And in this particular systematic review, looking at a large sample size, it showed that minority groups in medicine are at risk for imposter syndrome. And these are some of the predisposing factors that might be unique to us as well. So I'm talking about students, and all of us here are faculty. Well, the reason I think all of this is relevant is because many of us work with learners. We supervise, we mentor, so we're putting out fires as they progress in their training. In addition, they become us. We are them. And these are issues that also can affect us as faculty. These are some of the things that came to mind. I think as Latinx faculty, we probably not uncommonly are the only ones in our department, or one of a few in our department who are a person of color. And it's not a surprise that for some of us, we actually may have this extra burden of having to advocate for other communities of color, including the Latinx community. And this is known as a minority tax, where we're given extra tasks because of our group membership. In addition to that, there's other phenomena that can happen, such as microaggressions and stereotype threat, some racial discrimination. So this would be like a more macroaggression. I think in addition to our clinical responsibilities and our teaching responsibilities, we may have additional responsibilities that might not necessarily be present for our other colleagues who are not Latinx or people of color, such as taking care of additional family members. And then I wanted to mention some intersectionality. So there have been some other aspects of being Latinx, but also being a woman, for example, right? Studies have shown that as people progress in academic medicine, there's actually a good number of assistant professors who are women, but when you go into the full professorships, there's actually even less. So being Latinx and gender could actually be a source of stress. Other intersection identities could be being a first generation as well as an international medical graduate. So this segues to really our next portion of the talk. So we have two panelists who I'm about to introduce right now. So I'm really fortunate, all of us are, to be here with two of my colleagues who are psychiatrists. The first one is Dr. Elizabeth Holman Sandoval, and she is a child and adolescent psychiatrist at University of Iowa, Carver College of Medicine. She is a child and adolescent psychiatrist. She has an interest in cultural psychiatry, pediatric mental health, and collaborative care. She is actively engaged in mentoring, advocacy, and organized medicine through the American Academy of Child and Adolescent Psychiatry, also known as ACAP, the American Psychiatric Association, the American Medical Association, and the National Hispanic Medical Association. Dr. Holman Sandoval has been serving on ACAP, the Committee of Integrated and Collaborative Care, and she's been working with colleagues on this highly anticipated and soon to be published clinical update on this particular topic. She has also been awarded the AMA Women's Wellness through Equity and Leadership 2.0 Fellowship in this year. And she will be presenting on unique stressors that affect Latinx identified faculty members. Since I am also doing introductions, I'm also going to introduce the second speaker. And this is Dr. Mauricio Thojan. He is the chairman and the Department of he's the chairman of the Department of Psychiatry and Behavioral Sciences at the University of New Mexico, where he is also a distinguished professor. He is well accomplished and very influential. He has an area of expertise in the treatment and outcome of bipolar disorder and first episode psychosis. And he's authored over 350 original publications, many of which have been cited. In 2014, he was recognized in Thomson Reuters' The World's Most Influential Scientific Minds, which where honorees were ranked in the top 1% of citations for their published work between 2002 and 2012. He's also been given numerous awards, and he's been recognized as top less than 1% expertise in bipolar disorder worldwide based on his many, many publications. He will be presenting after Dr. Holman Sandoval on the unique stressors affecting Latinx faculty who identify as IMG. So I'm going to first hand it off to Dr. Holman Sandoval. Thank you.
Thank you so much. Hello, good evening, everyone. Or good afternoon, depending on where you are in the country right now. So I'm going to go ahead and pull up my slides here. Just move around. There we go. Okay. As you said, I am at the University of Iowa Carver College of Medicine part-time. I also work at the Memorial Medical Center in Ashland doing telepsychiatry. I also have a small private practice. So as many child and adolescent psychiatrists do, since we are in such dire need, I hold many hats. I have been extremely involved with Latino Medical Student Association since medical school, and am very honored to still be very involved. Many of the identified stressors that were just pointed out, I personally have encountered and have impacted my personal life stress-wise through training and through my career, and then also, as I mentioned, I have been very involved as a mentor and an observer with the medical students, and then as faculty. And I've seen and heard, many stories of other faculty going through these stressors. And so I thought that I would comment a little bit on these, including some stories, and then, some, there are, there's literature as well. So lower parental wealth is documented. Some of that literature is in the AAMC MSQ data. So this is my family. That's my abuela and me and my sister. I'm about 6 there. My sister Brianna and my grandma and grandpa. So my grandparents immigrated from Mexico when my dad was about 5, and they did cross the border without documents. My dad was part of, in the 80s, the grace period, and was able to get citizenship, luckily. And but when they came over, they did migrant farm working, and so my family, is pretty. I did not come from very much wealth, and but we have a lot of other strengths and a lot of love in our family, and so I very much identify with being leaned on to help with supporting other family members and parents, and having a lot of student loan debt, and I hear that from a lot of other friends and faculty, and actually I hear that a lot from people who want to go into academics and don't, because of the high student loan debt that they have. So that's something that I try to bring up a lot in academic circles. Anyone that knows me knows that I do that quite a bit. Higher ACEs scores. So as a child and adolescent psychiatrist, this is something that we talk a lot about. Surgeons in the room, maybe you haven't heard of these, but primary care, I think, is probably pretty familiar with it. I don't know, maybe I'm underestimating the surgeon. I apologize if I am. But adverse childhood experiences, or ACEs, are potentially traumatic events that occur in a child's life. And there has been overwhelming research and literature now showing how much this impacts future health. and so much so that it's really changed funding and really changed the way states have allocated funds for social services. So unfortunately, there is a lot of data that in the Latino population and in the immigrant population, there is increased ACEs. 4 or more ACEs is known to be much higher rates of worse risk of medical issues further in life, and that's a much higher rate among Latino population. And there's also a lot of literature talking about in crossing the border. There is a lot of violence and trauma that frequently occurs. When I was in medical school, I also got my Master of Public Health, and we did a big study looking at a population that was in the Chicagoland area in just north of Chicago, and a small town in Mexico. And there was a lot of migration from the small town to there. And so the trauma rate from just crossing over skyrocketed in that population. Soft skills overtaxed but overlooked. So that's something I experienced quite frequently and I hear about a lot. There was a paper pretty recently about Latinas being asked to act as translators and then, being reprimanded when they decline as medical students and physicians. I hear faculty, I hear especially Latina faculty talk about this quite a bit. Their soft skills being utilized frequently, but not being utilized when looked at for promotion. Microaggressions are something that I think, we've been hearing about a lot over the last, year and a half or so, but I would say I was hearing about it kind of when I was getting my Master of Public Health, and I don't think as many people were talking about it back then. I heard about it at a conference, LMSA conference in San Francisco, and I think, that was one of the first times I heard about it at an LMSA conference. But I'm really glad, that it's being discussed much more now, and implicit bias. When I kind of first heard it being talked about, I heard a lot of kind of systemic and institutional denial of it in certain settings. And now, I see that it's much more recognized and agreed upon that it does exist. And so I think that's validating to our faculty, to each other. I know that I have heard, from many of our students and colleagues, many examples of microaggressions that they've gone through. That's a lot of extra stress on top of your training and your day-to-day work. Talked about historically excluded, which some are now recommending, shifting the language instead of saying underrepresented. I love this picture so much. So this is a group of friends that I have become very close to through all the years in LMSA and forward. And that is the spot, for inauguration, for the presidential inauguration. And that was one of the times we were out in DC doing advocacy with NHMA. And I just feel like that is such a great vision of, us being represented, going out there and using our voice for Nuestra Gente. And I just love that photo. Here I love this photo for, how many examples I can think of and how many times I can think of so many mentors that I've had, Dr. Vela, Dr. Laje, where, you just see the one, Latino faculty member that is on every committee, is the mentor to every student. It has the brown tax. And I hear from my colleagues and my friends the guilt and the struggle of, but if I don't do it, who's going to do it? And somebody needs to do it. And I know I struggle with that. And I know in putting together this talk, even, I was really struggling with, wanting this to be perfect because, wanting to really help all of you with your own mental health and be supportive. And so that's, again, something that we all have to recognize, that we can't do it all. And we are, we do have a group. And so this was really something that was really wonderful over the pandemic. We've been collaborating and joining forces over social media through organizations like, Almacén Líderes. Now we're talking more, collaborating more, and we created these things over social media to promote vaccination. So, which, by the way, I would recommend that everybody after this talk promote mental health in some way on your social media, decreasing stigma or promoting some sort of mental health organization. And finally, with Latinas, I think there is some specific stressors to the Latina population. Again, for myself, I know I definitely could identify with that over the pandemic. Childcare fell solely on my shoulders, and I was also working full-time as a physician, and it was very intense. Luckily, medical students around the country volunteered to help a lot of the women physicians with caring for children, since the medical students weren't in rotations. And that's how I got through April and May. And it was extremely helpful. But I do think that there is, some extra pieces to that with their culture. And there was this great mural that I saw today on social media. And I think, that our culture does recognize that we are tasked with extra things. So this is my little guy, and he loves to help me prep for conferences and get me beautiful. So I want to say thank you to him, my little Marco. And I just want to say that I am giving this talk in memory of my primo Alex today, who passed away recently and who struggled with mental health himself. And this is my contact information and some of those websites that I highly recommend if anybody wants to share those on social media. And I'll pass back.
Thank you so much, Dr. Homan Sandoval. We have about 10 more minutes, and then I would love to open it up for sharing of ideas. I think now I'm going to hand it over to Dr. Thohen, who will present to all of us. Let's see, I thought I saw Dr. Thohen here a few minutes ago. Did he fall off?
Great to be here today, folks. So as Dr. Resta mentioned, we need to finish before the 4:30 or 5:30 for some of us to leave for questions. So as Dr. Resta mentioned, part of the challenges that Latinx people experience is immigration and being foreign medical graduates. So I'm going to address those issues and I'm going to talk about myself. And as obviously, as you can tell from my accent, you can tell that I'm an immigrant. So I grew up in Mexico, completed medical school there, and then came to the US for training. So I am a foreign medical graduate. So let me tell you my experience. I first did my residency in Toronto, and I wanted to become a researcher. So I decided that I wanted to go to the place that would offer me that opportunity. So I moved to McLean Hospital, which is one of the Harvard hospitals. Most of the residents there are really come from the best institutions. There are a few foreign medical graduates, but there are some. So it was very competitive. And then I had to think about how am I going to excel in this place where many people graduated from Harvard Medical School or other institutions, and I'm coming from the Universidad Nacional Autónoma de Mexico. So there you have a disadvantage. So I did it as many of us immigrants do, which is to work hard. So I felt that I had to do something that others had not done. So many of those of us who start doing research do a master's of public health to get some information. But I thought I had to go the extra way. So I decided to get my doctorate in public health, and that took a number of years. But to me, that was the way that I was going to differentiate myself from others, not including local and for that matter, other FMGs. I was very fortunate that I had a good mentor. And actually, I prefer the word promoter, like they do in boxing or in the UFC, meaning it's not someone who would just give you advice, but someone who actually will help you along your career. And I found a mentor and promoter, and he was very helpful to me. As mentioned, I did work longer hours than most. That led me to have a position at McLean. And then eventually I moved to the pharmaceutical industry to do research. And I must mention that when I was in Boston, although obviously I'm Latino, at that time there wasn't really what we have now, that people identify themselves like Latinx. And yes, we talk about the challenges that we have, but also about how we can contribute to society. So I didn't really live that experience. Maybe it was just myself. But then I moved to San Antonio, and that place was different because you have a Hispanic community. And that was very influential in my identity. I decided that what I really wanted to do was to work for the Hispanic community. As Dr. Resta mentioned, I had published quite a bit, got grants and so on, but my publications were in methodology, outcome in bipolar disorder and so on, and not necessarily focusing on the Latino community. So I made that decision when I was at San Antonio. I'm the chair of the department now, and I actually thought of being a chair early in my career. That was my goal, which was 20 plus years ago. And as mentioned in the previous lecture, I just joined at the end. There's different ways to get to becoming a chair. My route was through academics. And I soon discovered that being in academic and a chair, there you can't really do both. You really can't, because once you're a chair, you have to look after others as opposed to your grant, your publication. So it is quite different. So now in New Mexico as chair, the challenges that I have, I think among the chairs, I think I might be the only FMG. There's another Latina, but she was raised in New Mexico. And one of the things that I need to be very careful is that, of course, I need to look after the fellow Latinos, but as a chair, I have a responsibility with everybody. So I have to be very careful that I don't have as favorites the Latino young faculty or learners. Something that has been very helpful to me in my career is developing a network. In fact, when I thought that I wanted to be a chair, the first thing that I did is I networked with other Latinos who were chairing other departments of psychiatry, and that was very helpful. They gave me good advice, and in fact, when I was coming to New Mexico, initially one of the contacts that I had, not the only was with the Latino community. So I'm going to stop here, and my take-home messages to you is that for me, what worked was, as any immigrant, whatever you do, work harder than the rest. That's the way that worked for me. The other thing that worked to me was finding a good promoter, not only mentor, a good promoter, and then to network. When I made the decision to move into having more responsibilities, what helped me a lot was to network. And once you're in a position of leadership, yes, of course, we have to help our Latino colleagues and learners, but we also have a responsibility with the rest of the department. So one has to be careful about that. So with that, I will stop. Dr. Uresti.
Thank you both, Dr. Homan Sandoval and Dr. Tohen, for your very personal reflections.
And 20 minutes, as you asked me to do, it's 20 minutes past the hour now.
Thank you for also being very punctual and all of that. So I had a couple questions and definitely want to open it up to everyone here in the session. If you have questions, you can either type it into the chat box, or you can just raise your hand or unmute yourself and ask questions. I wanted to first start off with a couple questions for both of our speakers. What strategies have you personally found to be helpful for supporting your own mental and emotional well-being? Maybe we can start with Dr. Tohen.
Well, my family. I have a terrific partner, my wife, and she is my support. So that's what has been helpful to me. And my children. I have 5 children, 3 from my first marriage, 2 from my second marriage. And actually, my older sons, they are in other parts of the country. And we've talked more often. For that matter, my family in Mexico, I have siblings there. And I really was not that much in contact with my siblings. And it's been being in communication with them, that has helped me. And another one, I had lost touch with my high school classmates. And actually, after this meeting, I've completed high school many years ago. So I hadn't talked with my high school classmates for a long time. That's also has been very helpful. So it's getting back to my roots. That's what has helped me. I'm sure there are other ways for others. Dr. Oreste.
So actually, the last couple of years have been very difficult for me. I went through a divorce. We went through the pandemic. My dad had a stroke when I was in medical school. And so both he and my mother rely financially on me. And I'm very much in deep medical school debt. And so I have been very much exploring ways to cope with stress, especially with having very busy medical practice, and especially with child analysis psychiatry becoming ever more necessary and the crisis of children's mental health growing. And so what's been really helpful for me, especially in the last 6 months, has been definitely making sure that I'm making time for self-care, making sure that I am putting myself first and making sure that I'm valuing myself. And so that goes back to kind of being aware of, what are my values and what is it that I'm trying to accomplish, and what are the stressors that are going on in my life. And so that was kind of also why I thought it was a good point to talk about some of the stressors that a lot of us are facing, and validate them. That it's not that because for me going through residency, and for a lot of the people that I talk to, colleagues, students, a lot of those stressors have been invalidated or told that we're imagining it, or it doesn't exist, or we just need to, just work through it, be stronger. And unfortunately, we have colleagues that are committing suicide. There was 3 residents recently from the same hospital that just committed suicide together. Well, not together, but, in a short period of time. So this is serious, and our colleagues are not going to get therapy help. So I brought this topic up when we were planning for this conference, and said, we really need to make sure that we have a talk about supporting our colleagues in their mental health. So just making sure that it's on your radar, that you are balancing your own mental health and practicing self-care.
Dr. Oreste, if I can add a comment.
Mm-hmm. Please.
As Dr. Homan Sandoval mentioned, we are clearly in an epidemic of psychiatric conditions. I can tell you, and including among our colleagues, increased drinking, drug us, suicidal ideation. So it is there, and we need to be very aware of it. And us as psychiatrists have a responsibility with our colleagues. So one of the things that we're doing at the University of New Mexico is our department, many of our faculty has volunteered to provide counseling, not only the psychiatrists, but also the psychologists and social worker, to colleagues who are in need. So as Dr. Homan Sandoval mentioned, our healthcare providers in a way are at higher risk. So we need to provide that care. And when you need it, you should ask for it. Dr. Oreste, back to you.
Thank you, both of you. I would share that I'm an early career physician, so I still have lots to learn. I would say the transition has been very stressful. I think as a junior attending, I think there's a lot of people who offer extra tasks to do, and it's difficult to say no. And of course, many of those things are really important to be involved in, also further develop my skills. I would say some of the things that have been helpful for me in my early career would be to really look for ways to have adequate sleep. I've noticed that when I am sleep deprived, I become emotionally sensitive, which can really be hard to be resilient. It's difficult to be resilient when times are stressed. I am very fortunate to engage in psychotherapy as a recipient of it. I get undergo weekly psychotherapy, and fortunately, it's been through Zoom even before COVID-19. So I've been able to resume that during this very stressful period. And then I also wanted to just mention, it's been challenging to regularly exercise. It's been kind of my New Year's resolution every year. It's probably going to be my New Year's resolution for this January again as well. But I have noticed that when I am able to go for runs, especially on a regular basis, that really helps with my resilience. So I think those are some of the things that have been helpful for me. And then the last thing I would say before we're out of time is having mentors of various sorts. So Dr. Thohen had mentioned mentors. Dr. Holman Sandoval had talked about having a peer of friends. Peer mentors have also been very valuable for me in terms of helping affirm many of the challenges that I may have experienced, and helping someone who's more experienced, helping me guide through, helping me navigate through some challenging situations. We have about a minute left. I just wanted to acknowledge Dr. Amador, who had put in the chat actually a handful of resources, which I think are really great, including a paper on minority tax for those of you who haven't had a chance to look at that. We have maybe like 30 seconds to a minute. Any questions or comments before we hand it off to the next session?
Yeah, can you give that percentage of suicide rate for medical students?
Yeah, it was 11%.
11%. I mean, that is mind-boggling. What is it in the general population?
I don't know that number off the top of my head. Do any of my psychiatric colleagues know?
When you say 11%, what's the denominator? You mean of all medical students, 11% commit suicide? That sounds, or attempt suicide, that seems like a big number.
Yeah, actually, that's a great question. I can pull up the paper and then put it in the chat as well for reference.
Thank you. If that's true, we have another pandemic, so to speak.
Even if it's not true, we already have a pandemic of anxiety and depression and actually excess drinking and use of recreational drugs.
That number is actually for suicidal ideation.
Oh, yes. Thank you very much.
Okay. Thank you for clarifying.
So, yeah, and there's a national physician support line that was started by women psychiatrists during the pandemic, and it's all volunteer and anonymous. That's free. A lot of institutions are doing that within their institution for physicians within their institution, but there's a national one as well.